ionized calcium a good test for hypocalcemia? I mean, yes, it is. I mean, but you have to understand, Juan, that calcium becoming low in the blood, your body's really good at not letting that happen. And here's why. Your calcium levels drop too much, it will kill you. So your body has adapted. It's adapted to, you have a gland next to your thyroid or beside your thyroid called the parathyroid gland. And so it makes parathyroid hormone or PTH. And the PTH travels to your bone and it tells your bone to release calcium. So what happens is, for most people, is that we're not going to measure low calcium in the blood because the parathyroid, if it's working properly, is going to break the bone down to get access to the calcium from the bone, and it's going to keep the blood calcium levels nice and stable, because again, that's a life-threatening situation if calcium were to drop too low. So it's if by the time you're seeing hypocalcemia on a blood test, this has been going on a while and you probably got bigger problems. So it's not the best test. The best test to really measure for calcium, if you're really trying to look at calcium, is intracellular analysis. So looking inside the cells, not necessarily looking inside the serum. Now, it's also good to get both. So get a serum level, but also get an intracellular level. That way you have both compartments that can be looked at. Okay. At what age should women have bone density tests? Great question, Melanie. I really don't recommend bone density tests. Let me explain why. Actually, I want you to do something. I want you to go back and watch my video on bone loss myths, because I talk all about bone scans. For about 45 minutes, I talk about bone scans and why they're not really all that great. But the simple answer is bone density scans don't measure bone health. They measure how well your bones absorb X-ray. That's all they're measuring. And how well bones absorb X-ray is not a marker for bone health. And so a lot of times what happens is if a woman gets into menopause, or in their upper 40s, 50s, they're getting a bone scan done and the doctor's saying, "Oh my gosh, you've got bone loss." You have to understand the bone scan is based on those numbers. These are what's called a standard deviation bell curve to calculate the numbers. But those numbers are based on 35-year-old females. And if you're 50 or 60, know that bone density scan is comparing you to a 35-year-old. So it's not a fair comparison. So I just don't really recommend looking at bone density scans as the end-all be-all of evaluating bone health. There certainly are better tests. So if you're looking for tests that you can ask your doctor to run, ask them to run all those nutrients that we just talked about: the calcium, the magnesium, the zinc, the selenium, the copper, the chromium, the B vitamins, etc. Ask them to run that. Ask them to look at that, because if your nutrition is off, then your bone health is not going to be potentially not going to be adequate. There's also a couple of urine tests that can be run that measure how fast your bone is breaking down versus how fast it's building. And those tests, one of them is called osteocalcin. The other one is called a pyridinium crosslink test. So those are tests that your doctor can measure, that your doctor can order. They may look at you funny when you ask for it, because most doctors don't, they're just not ordering these types of tests. They're all kind of fixated on bone density scanners. And I honestly, I don't know why. I've never really used them. I've never really referred people out to them, because they just aren't great assessments of bone health. And so we really want to know about bone health, not how well your bone absorbs X-rays. Let's see here. Question coming in. How do you slow bone loss when you have to take medications? It's a good question, but I'm going to throw this out at you too. I'm going to say, why are you having to take medications is probably the better question to ask, right? I mean, it depends on what you're taking medications for, but most people taking medicine for chronic disease, they need to have a different conversation with their doctor about why they have chronic disease, because medicines don't cure disease. I mean, hopefully that's not a newsflash. Medicines alter your biochemistry to change your symptoms of what you're feeling, or the symptoms of how your body is feeling. So for example, if you have high blood pressure, you take a blood pressure medication, it reduces your blood pressure. Your blood pressure being high is a symptom, but why is it high? Okay, same thing, your blood sugar. If you're taking a drug to lower your blood sugar, why is it high in the first place? So remember, if you're taking medicines, you have to ask the question, why am I on these medicines? Don't think about what else I can do, what else I can take to continue to justify taking these medicines. Ask the bigger and more important question, which is, why am I being put on these medications when there's probably a diet and a lifestyle change that I could make that's going to lead to a resolution of the need for those medications? And if you haven't already, pick up a copy of No Gray, No Pain. There's a lot of information in that book that might help you navigate the waters of chronic disease a little bit better. Let's see here. So I think I may have answered that. So again, suggestions for best tests that check bone density. If we're again, not checking bone density, but checking bone health. And I think that's the important thing to realize, is that bone density is one aspect of health. And so a good bone x-ray can tell you about bone density, because, you know, if you got a good doctor that knows how to look at an x-ray and read an x-ray, that can actually evaluate and see early bone loss on x-rays. You can do a bone scan. I said I don't recommend them because I don't like the emphasis that they put on people. I think they stress people out more than they help people, because they get people in the mindset that they have bad bone. But remember, if you're over 45, 50 years old, you don't want to compare yourself to a 35-year-old. It's not a fair comparison. So it really isn't, to me, it's the test itself, you have to take it with a grain of salt. But osteocalcin and deoxypyridinoline are two tests that measure bone turnover, and they're urine tests, so they're non-invasive, and there's no radiation with them. So those are really safe ones to assess, again, how fast your bone is building versus how fast it's breaking down. So those are great screening tools to begin the thought process of, do you have a bone loss problem creeping in? Let's see here. Somebody's asking about Paget's disease. Could gluten have played a role in Paget's disease? Yes, it could have. I've actually seen some studies that show a connection between the two. Next question, what about elevated CPK, creatine phosphokinase, in relationship to inflammation? So CPK, yeah, I mean, it's an indirect measure that bone could be breaking down or that muscle could be breaking down. And so it can be an assessment, but it's not a direct assessment. It's an indirect assessment. It doesn't tell you, it tells you that there's a problem, but it doesn't tell you what the problem is, not specifically. Whole body vibration, somebody's asking about. Love it. I've got a vibration plate in my garage where I have my gym equipment too. So whole body vibration is a great way to build bone. These are platforms you can stand on and do different exercises on that actually oscillate at different frequencies that can help to stimulate bone. The platforms were actually developed by the Russian space program, because when the cosmonauts would come back from being in the space station for months on end, of course, with no gravity environments, you have a reduction in bone mass. And so to rehab them back, the technology was developed to expedite that in a quicker fashion. So yes, I really, really like whole body vibration units as a general. You can do squats on them. You can do push-ups with them. I mean, again, you can do a number of these body weight exercises that I talked about on this other page over here. And you can do those on a vibration platform, and you can make your exercise even more effective. Okay. How to deal with bone spurs. So Tammy wants to know. So Tammy, remember that bone spurs, like if you've got them in your spine, probably one of the best things you can do is see a good chiropractor. But if you've got like a heel spur, for example, like a bone heel spur, one of the top causes of heel spurs, and again, I don't know if this is specifically your question, are tight calf muscles. So remember, bone grows based on pressure. So if there's increased pressure on the bone, the big part of identifying how to deal with the bone spur is finding out how that abnormal pressure is being put on the bone. So like a lot of times with x-rays of people's necks, we'll see bone spurs coming off the vertebrae, and those bone spurs are signs of abnormal posture or abnormal head position over time. So like if somebody's at a computer screen all day long and the abnormal pressure and force from gravity and the weight of the head, which weighs about 16 pounds, is coming down, they can form spurs in different areas. And so the way you would get rid of those or help the body resorb those is to correct the postural imbalance and to correct the behavior. Same thing with heel spurs. Heel spurs are generally very, very tight Achilles tendon and calf muscles. So if you can't palm the floor, if you can't bend over and put your palms on the floor, then your calves and your hamstrings are probably way too tight. And this happens to a lot of people who sit at a computer desk all day long. So the focus might be stretching out your hamstrings and stretching out your calf muscles a lot more aggressively or a lot more consistently to take that pressure. Again, that tight muscle pulls on that bone, on that heel, and it can create that spur. So again, just depending on where your bone spurs are, it's finding where the abnormal pressure is coming from and then adjusting the behavior around it. Okay. Will vitamin D build bone? Vitamin D is not necessarily building bone, but it's helping mineralize bone. So again, vitamin D tells your small intestinal cells to absorb calcium. And without vitamin D, your small intestine doesn't do a very good job of absorbing that calcium. And so subsequently, your bone will break down. Is coral calcium a good source of calcium? No. If we're talking about supplementation, if you're looking for solid calcium supplementation, really probably one of the best forms is calcium citrate. Calcium citrate, calcium malate, these are amino acid chelate versions of calcium, but your body can absorb them better. Whereas typically coral calcium, it's got a lot of calcium in it, but that calcium that's in it is not widely and highly bioavailable. It's harder to digest and assimilate. COVID question. So I'm taking quercetin, zinc, C, D3 along with cutting out the simple carbs and exercising. Do you personally know anyone who's contracted a severe case of COVID? Several have called in to me that have and have done very well with those nutrients and not needing to go on into the hospital and progress to a very bad state. So yes, I do personally know people that have contracted it that do well with nutrition. Now, that being said, I will just put in this disclaimer. There are no known cures, treatments, potions, or lotions that you can take to treat COVID-19. And so, take that, for what it's worth. Can high-dose vitamin D remodel joints? No. Again, high-dose vitamin D is going to increase calcium absorption. It's not going to remodel your joints. What's going to remodel your joints is, again, the fundamentals of health: good sleep, good exercise, good food, good sunshine, clean air, clean water, and modulating and controlling your stress levels. Those are the things that will remodel your joints. I know I see a lot of people that come in and that there are other doctors that have said you're bone on bone, or they said you have you have no joint space left, or your joints are just basically arthritic. And they overstate the arthritic nature of their joints, and they tell them it's not, you can't heal it, you don't recover, arthritis is permanent. And that's just not true in my experience. I've seen a number of people come in with arthritic joints, and when they start changing their diet and their lifestyle, losing weight, taking care of their bodies, their joints, just like the skin, if you get a cut, it naturally heals and repairs itself. Your joints can do the same thing if you take good care of them. Now, you can let it go too far, certainly, and there are people that have let it go too far where the joints are not going to make a full comeback. But that doesn't mean that you still can't make changes, meaningful changes that improve your overall joint health. Can I claim compensation if a hospital missed my fracture? That's between you and a lawyer. I don't know. I mean, I don't know. That really is between you and the lawyer. If it was undiagnosed and untreated, I would go back to the doctor who missed it. And but I mean, I'm not a big fan of the lawsuit like that. And frankly, the reason why is it doesn't accomplish anything. It doesn't move you forward. It keeps you in a state mentally and emotionally where you're just you're angry, right? And that's hard to overcome. And that's hard to move on, and that's hard to heal when you're angry all the time. If you're again, now if you need compensation because you need to be able to seek out medical treatment, again, that's something you might just consult an attorney with. And I would talk to the doctor who missed the diagnosis. He's a human too. Doctors make mistakes, and if it's not a totally life-threatening, life-altering mistake, I mean, they're just like anyone else. They can make a mistake. They can miss a fracture. They can miss I mean, I'm not saying it's great, but it does happen. Can infections contribute to hip pain? They sure can. If you've got chronic hip pain, one of the best things to do is ask your doctor to x-ray your hip. Sometimes you can see an infection in the bone off of an x-ray. So infections definitely are a potential cause for hip pain. Not the only cause, but definitely can. Collagen supplementation, can that assist in joint health? It absolutely can. Collagen can be very effective. Many people don't eat the collagen from the food. So, when you're eating just animal meat tissue, so those of you who aren't vegetarian or vegan, if you're a meat eater and you're just eating the meat, but you're not eating the bone or the bone marrow, you're not using the bone broth, like a lot of the collagen sits in that tissue. And so most people don't gnaw the cartilage off of a chicken drumstick, for example, which is where a lot of that, that collagen would be if you were eating it in the diet. So collagen supplementation can be a great way to get that collagen in. Can hip pain be something serious? It absolutely can be. Hip pain, I mean, hip is an area where you can have infections, you can have tumors, you can have fractures. I mean, yeah, you could have a serious problem if you have chronic hip pain. That's why it's always a good idea to follow up with a good doc and, have some orthopedic testing, possibly some imaging done to see what's going on internally. But yes, hip pain can also be not serious. Hip pain can be muscle imbalance. Hip pain can be the joint itself is not lining up properly. So, I mean, there are a number of reasons hip pain can occur. Some of them are more serious. Some of them are less so serious, but I guess it just depends on you. If you're the one having the pain, it's probably serious, but you probably wouldn't want the diagnosis, say, of a bone infection versus, say, a muscle imbalance is a lot easier to correct, a lot less invasive. Let's see. Nancy says, since gluten is gone, arthritis is manageable. I love it. I'm waiting for your book still, but I ordered it from a tiny bookshop and she ordered one for herself. I convinced her. Awesome, Nancy. Thanks. Yeah, the more we can spread the word, the more people we can help. Can gluten sensitivity cause scoliosis? Theoretically it could. I haven't seen any great research and haven't seen any great correlation on that, but there are different forms of scoliosis as well. I mean, there certainly are kind of more advanced congenitally developed scoliosis situations where, for example, when somebody is born and their vertebrae is like a congenital defect of the vertebrae itself, and so it puts the spine in an abnormal lining position, and so over time as they're growing, scoliosis can become more advanced. Is it possible that gluten could have contributed to the bone abnormality? It's plausible. Again, I haven't seen any great compelling evidence or research, nor have I seen anybody in my practice where I could say, yeah, gluten caused that person's scoliosis definitively. So I would err more to the side of the caution of, if you've got scoliosis and you're looking for a cause, for many people it's muscular imbalance. It's chronic positioning. And so if you get with like a good chiropractor, a good physical therapist, somebody who really deals with a lot of scoliosis would be your best bet. Fred wants to know if I recommend calcium supplements for bone health, or should you focus on other things like collagen and vitamin D? It depends, Fred. Again, going back to what supplements do I recommend everybody take? At the end of the day, I recommend everybody take a multivitamin. A multivitamin that contains vitamins and minerals, not necessarily in mega doses, but in decent doses as an insurance plan to good food. Because if you're eating good food, you should be getting good nutrition. Now, sometimes a person needs to be supplemented with therapeutic doses of a nutrient. And so to make that decision, my advice is ask your doctor to measure it, test it. Because can calcium be helpful? Absolutely. One of the most common things that we see with calcium deficiency is nighttime leg cramping. So like calf and foot cramping happens a lot of times, and calcium can resolve that sometimes in as little as one dose. That being said, should you take calcium indefinitely at high doses just for the sake of bone health? No, because look, bone health, osteoporosis is not a calcium deficiency disease. It can be, but it isn't always. So again, testing, a good good food, but testing is your best bet to really take higher levels of nutrients. As far as calcium magnesium ratio, 2 to 1 is a good ratio, but it's, sometimes a person is calcium deficient but not magnesium deficient, and vice versa. So you don't always even need to follow that ratio per se. A lot of people get hung up on the ratios between nutrients. And again, if you're getting testing done, if your doctor's testing you, you don't need to worry as much about the ratio. You need to worry about correcting what's actually low. Yeah, right. I know Miguel, he said LMAO, right? Because, I mean, how many doctors actually do this stuff? Look, nutrition is not sexy. It's not like a surgeon. It's not like jet pilot or jet fighter pilots, right? It's biochemistry. It's hard work. It's a lot of knowledge. It's a lot of books. It's a lot of studying. And so most doctors don't gravitate toward it because it's more than what they want to get into. And most doctors, well, I don't want to generalize for all of them, but the vast majority of my experience is most doctors spend 5 or 10 minutes with a person, don't have any nutritional foundation, don't know anything about nutrition. And so the only thing they really ever share nutritionally is how unimportant nutrition is. So like if you go to your doctor and say, hey, does nutrition have anything to do with my joint pain or my bone loss? They're like, no, just take a calcium supplement and take this medication. In essence, they tell you nutrition isn't important, but not because it isn't, but because they just don't know any better. And so they can't engage in that kind of conversation. So I can understand how a lot of you might be frustrated in that regard. Is there any way to reduce or reverse bone loss once you already have a great deal? Yes, you can improve your bone density. I mean, your bone, again, it grows based on pressure. So can you reverse bone loss? You can, but you've got to work at it. It's not one of those things that you can do passively. Some people want to just pop pills. Remember, popping pills is passive therapy. Bone, in order for it to grow, you have to have activity. So passive therapy is great to support the nutrition. But again, you're not going to grow denser bones by popping calcium pills or any of the other supplements that I'm talking about here if you're not combining it with sleep and exercise and stress management and solid food. And that takes work because we live in a society where convenience is king. Everybody wants what's quick and what's easy. And remember, those that work hard for things, it's worthwhile, right? Work reward. And so you've got to put in the time, you've got to put in the effort if you want that reward. So don't just think that passive supplements are the answer. Let's see. Gloria, that question, good question, but it's way, way, way too complex, to answer in this format. I don't want you to think I'm ignoring you, but that's probably more of a question to ask a doctor. And if you're looking for deeper help, call my office and talk to my people. Okay. Let's see here. Let's go down a little bit more there. Why does bone hurt if you're gluten-free for a very long time? Back and joint pain. I'm just 50. Well, if you're gluten-free, I don't necessarily think you can equate being gluten-free to your bone pain. And remember that not all bone pain is caused by gluten, and gluten-free diet doesn't necessarily cause bone pain. So if you're struggling with back and joint pain, and you're relatively young, then get with a good doctor to figure out why. That's really it's a simple question, but there's a complex answer, because if you're struggling, it could be a number of different things that can be causing your pain. And certainly nutritional deficiencies at the top of the list. Food allergies could be part of that as well. So could things like lack of activity or sedentary lifestyle. So again, there are a number of different things that could contribute to that. Let's keep going down on that side. Too much thyroid. Okay, so Marie says, regarding too much thyroid, in previous talks, she had mentioned recommended amount of protein intake can vary according to lifestyle. Could a similar logic apply to the recommended dosage of levothyroxine for Hashimoto sufferers, or is the TSH-T4 the only reference to take into account? No, so that's a great question to what we were talking about earlier on TSH. I was simply using TSH as an example. Not to say this is a comprehensive evaluation of thyroid hormone, because TSH by itself, or even TSH with T4, that's not comprehensive evaluation of the thyroid. There's 17 nutrients your thyroid needs to function properly. There's also T3 and reverse T3 that should probably be measured. There's cortisol that affects your thyroid that should be being measured. So there's a lot of things that go into evaluating, your thyroid hormone. But going back to your question, which is, by that logic, could a person need a different level of a thyroid medication based on their activity? And the answer is yes. Everybody's unique and everybody's different, which is why you got to work with somebody who doesn't just you can't work with somebody who just corrals you into the same line with everyone else and gives you the same dose as he gives everyone else or she gives everyone else, because one size doesn't fit all when it comes to health. Can collagen, let's see, I think I answered that on collagen. Vitamins to boost the effect of collagen, vitamin C, copper is very important. Zinc is very important. So zinc, vitamin C, and copper, probably the three big ones if you're trying to, take things that will also support collagen supplementation. So oldies who have some disabilities. So if you're an older person, you've got some disabilities, you can still do Tabata, you just have to modify it. And so one of the ways you can modify Tabata is, for example, if you can't do a push-up, you can lie on your back and you can use bands and you can do push-ups on your back. And that way you don't have as much stress or pressure on your joints. And if your muscles are really weak, you can kind of start light and work your way. As you get stronger, it becomes easier. That's the great thing about working out, is the more you do it, the stronger you get, the more you're capable of doing. The less you do it, the weaker you get, the less you're capable of doing. So, many people are told by their doctors, hey, as you're getting older, you need to slow down. That's BS. As you're getting older, you need to keep going, because the second you slow down, look, as you're older, you're going to heal more slowly because of the fact of you're getting older. But if you slow down, it's going to be a lot harder to make a comeback as you're slowing down. So you want to keep going. Just don't keep going to such a great degree with your exercise that you injure yourself. Is there any one test that measures vitamin and mineral levels? No. There are tests that measure certain ones, but no, it's several different types of tests to get a really comprehensive look at a person's nutrition. Okay. How do I feel about strontium versus calcium? Maybe clarify what you mean by that. I mean, they're both important, and they're both important for bone health. Does nutrition for bones apply to teeth as well? It absolutely does. I've seen cases, interestingly enough, where people came to see me and they were told they had multiple cavities by their dentist, and they didn't want to get the composites or the silver amalgams put in. And so they made a decision to, let's just see what happens with nutrition. And I have several cases where when we got their nutrition really dialed in, their cavities actually, when they went back to their dentist to get another checkup, they weren't on the x-ray anymore. So I've seen cases where, and I would say with that, it can depend on the depth of the cavity. Because if you've got a really, really deep cavity, you're probably not going to see nutrition change that. But if you've got just some small ones, you might, again, you might see some changes with nutrition, because your bones, your teeth are bones in your mouth, right? Let's see here. So lots of you asking about remineralization of teeth. The problem with teeth is that once you lose them, they're gone. So taking care of them, obviously prevention is your best method, but a lot of people lose the density in their teeth, or they lose mineralization of their teeth because of high acidic foods, high sugar-based foods, just bad food choices as a whole. And not eating well. So can you reverse the damage of not eating well? Yeah, if you catch it early enough. But if if your teeth are hanging on by, a thread of collagen, they're getting ready to fall out, you're probably not going to reverse that just by changing your diet. You've got to catch it early enough where the body has the ability to adapt to the changes. Should estrogen supplementation be considered for postmenopausal bone loss? Possibly. That would be a good question for your doc that you're working with. My advice would be to measure your estrogen levels. Don't just randomly start taking hormones. Hormones are powerful drugs, and you don't just want to take them just for the sake of popularity. You want to take them, based on need. Let's see here. Yeah, so I hate to hear that. So my husband has major bone loss due to paralysis. Legs were amputated. Would sitting on a vibration plate work if he couldn't stand? So the magic of it will help his bone density, but the magic of a vibration plate too is doing the resistance activity on the plate itself. So if his arms are strong and he can use his arms, so you can actually kind of straddle that vibration plate, and again, depending on the amputation, he could do things maybe like abdominal lifts with it, in a dip type position. So there are a number of things that could be done with a vibration unit. Okay, let's see here. Would you please speak to the issue of estrogen replacement? I think I did. I think I talked about that already. So that question's come in a couple of times. Okay, yeah, we've got questions that just keep coming, folks. We got to wrap it up. We're running 10 minutes over. So, look, thanks for being here with me tonight. Thanks for sharing your Monday evening with me. If you know somebody that this information can help, please share it with them. Our goal here is to, reach 100 million people. We're trying to save 100 million lives. I can't do that without you. So if you appreciate me, show me that you appreciate me by sharing this information with as many people as you can. And if you haven't already, come visit me at glutenfreesociety.org. Make sure you sign up for our newsletter. We've got the world's largest gluten-free newsletter to help you navigate a grain-free, gluten-free diet to improve your health. And we'll send you a bunch of really great recipes and starter points on how you can get going on the diet. And make sure you subscribe to the channel here so that you can get posted updates when we publish new videos. And look, it was great spending Monday night with you. We'll see you next week for another episode of Pick Dr. Osborne's Brain. Have a nice evening. Hey, if you've got a functional medicine or health question that you'd like me to answer for you, make sure you send me an email, glutenology@gmail.com, and we'll do our best to create a video answer just for you. Have a great day.